Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health, the Wellness Forum Institute, and Make Americans Free Again. I'll remind everybody the Cancer Summit, which we held a couple of weeks ago, it was absolutely unbelievable, riveting, one of the best we've ever delivered. And you can still purchase recordings of that. And then we have some upcoming, and you can also get, by the way, I almost forgot to mention, Empower Yourself, which we had the same week, which was a free program. That you can still get a recording of if you would be interested. And then we have some things coming up that I know you're going to be interested in, our annual Food Over Medicine retreat. And somebody asked me the other day, are you going to cover the same things as always, or are you going to cover new stuff? Always new stuff. So some of the topics we're going to cover that I know you're interested in are, for example, the great protein debate. And we're going to cover some supplements like omega-3 and vitamin C and magnesium, and tips for habit change, and then subjects you've been asking about, like irritable bowel and gluten and glyphosate and inflammation and SIBO and etc. And then lots of time for questions and answers. It's going to be May 2nd and 3rd, and then a special free session on Sunday for those who want to put together a plan with what you've learned, to put it into practice so that you actually end up with better health. All right, we did this last year, sort of an afterthought, but it worked out so well and people got so much out of it. I just decided to include it, and we'll just plan on it. Sunday night session to get you started on the path to good health. All right. So May 2nd and 3rd, Friday night, Saturday, all day and evening with breaks for meals, and then Sunday night. So, and feel free to ask for special topics and that sort of thing. If there's something, burning questions, there will be, of course, lots of time for questions. But if you have something you're just dying to know about, send me an email. I've written a business plan for health professionals, how we can help you build a business. If you'd like to see that report, send me an email, pampopper@msn.com. So I have two news topics to cover with you today. And the first one is a wake-up call. It's a statistic that should wake everybody in this country up. According to a new study, just about 9% of US adults make it to the age of 70 without physical, mental, or cognitive impairments. All right, so I'm going to be 69 this year. I'm going to be one of them. Some of you listening are going to be one of them. But that means that 91% of people are going to turn 70 in the United States and have health issues, some of them pretty significant. We talk to those people all the time at Wellness Forum, right? So what is the reason for this? Well, the study included 105,000 people who were followed for 30 years. And this is not shocking. People who ate the most fruit, vegetables, whole grains, legumes, and unsaturated fats were more likely to age in a healthful way. And conversely, those who consumed more trans fat, sugary beverages, ultra-processed foods, and animal foods had the worst odds of being healthy seniors. In addition to diet, those who aged well were more likely to be physically active and to have a lower BMI, and also less likely to have a history of depression. All of these things are fixable. If you have a bad diet, you can adopt a better one. If you're not physically active, you can become physically active. In fact, remember, April 9th is the start of my next virtual yoga session. That could be one way to get you up off the chair and moving around, and it's not too terribly arduous. So you can do something about that. If you're depressed, it can get better. If you're overweight, you can lose weight. All of these things are fixable problems, and the earlier you fix them, the better. And remember, a couple things, it's not too late to start, never too late to start. And a couple things I'll remind you of. One is that one way you can do this that's fun with others is start a Food Over Medicine club. And the other thing is if you decide to do it with Wellness Forum and join, we still have you get a gift card for however much your dues are. And we're going to continue that a little bit longer. So this would be a great time to think about joining Wellness Forum. All right, the other thing I wanted to talk about today, I want to talk about for a couple of reasons. One, because it offers some insight into the way doctors think. I'm always being asked, like, why is the medical system so screwed up? And why don't doctors talk about diet? And why do they recommend this and that? All right, so this is a good lesson in why you should be informed, why you should take charge of your own health, and why you should take advice with a grain of salt and look into it, etc. All right, so I subscribe to Medscape, MedPage. Some of what is printed there or posted there is valuable. I learn from it. Some of it is just a painful reminder of how bad things are. This comes under that category. So this article that I'm going to talk about was written by Christopher Labos, is his name. He's a cardiologist in Canada, and he wrote an article called "On Second Thought, Statins Work. Don't Let Anyone Tell You Otherwise." So I was anxious to read this. The headline caught my attention. Like, what would this guy be saying about statins working? They are effective, by the way, for people who have familial hypercholesterolemia. They're sometimes recommended for people who've already had an event like a heart attack or a stroke or interventional cardiology. But when used for primary prevention, I've just never seen any evidence. So anxious to see if I would learn something new, I clicked on this article. So Dr. Labos starts by referring to a 1989 article that appeared in The Atlantic, and it was called "The Cholesterol Myth." And he claims that the author, it was behind a paywall, but I can just only imagine. He claims that the author of this article was right in stating that the diets that are known to lower plasma cholesterol levels are difficult. Most people can't sustain them. Well, right there, my antenna went up because that is completely contrary to what our experience has been at Wellness Forum, that many people change their diets and they stick with it if they're shown how and they see that the food's delicious and if they have compelling reasons for doing it. And it's also completely contrary to research posted and published by Dr. Esselstyn at Cleveland Clinic, who's shown that in decades of time, he's never lost a compliant patient to cardiovascular disease. His studies like 40 years running. And Roy Swank, who did the same thing with multiple sclerosis and a low-fat plant-based diet. So anyway, that's not our experience, and I just think it's so discouraging when people say, "Yeah, well, nobody's going to do it." Well, I'll tell you one way that you can make sure nobody's going to do it is don't offer it to them. Do not offer the diet option. Well, anyway, his real message, though, is about the benefits of statins, and so anxious to see what he had to say. He writes that they reduce events and mortality for women and older adults, and he says that the side effects are due to nocebo effect. And it's interesting he brings that up because we studied this book, The Nocebo Effect, on Saturday all day. It took every bit of about 4.5 hours to go through all the information in that book. And there's no question that side effects are sometimes a nocebo effect. In other words, people experience side effects because they expect to, but that's not always the reason why there are side effects from drugs. My father, when he was alive, was a person who had side effects from drugs, and it wasn't because he expected to. It's because he had side effects from taking statin drugs. But anyway, he acknowledges, Dr. Labos, that the sickest patients are the ones that are going to benefit the most from taking a statin. And he acknowledges that people complain about risk calculators, which I've written about, because what they've done is by changing the criteria for drugging people, more and more and more and more people qualify to take statins. But anyway, in one of the strangest things I think I've ever read, Labos actually agrees with me, but sticks with his recommendation. So he digs in his heels and says the absolute risk reduction for all-cause mortality from taking statins is 0.4%. He writes, quote, "It's not zero. Whenever someone claims that statins don't reduce mortality, feel free to call them a liar. An absolute risk reduction of 0.4% is a number needed to treat of 250. That's obviously not impressive, but it's not that terrible either." Really? All right, so 249 out of 250 people do not benefit from taking a statin, but that's not terrible, according to this guy. By the way, hate to tell you this, I know everybody likes to think that they're special, but you are far more likely to be one of the 249 than you are to be the one person out of 250 who's going to benefit. For cardiac events, the absolute risk reduction is 1.39%, and Labos is super enthusiastic about that very tiny reduction as well. So this is the problem with medicine. Doctors who, not by their own fault, they're not trained in diet and lifestyle medicine. They've never tried to help patients change their diet, and they don't have much interest in it. That is their fault. Then they claim that patients aren't interested and they won't stick with it anyway, so why bother? I mean, what an unproductive mindset. And by the way, not everybody sticks with it, but many people do. And they should at least be offered in a medical setting the opportunity to do it and they should see the data, this miserable data on the lack of efficacy for statin drugs, which I think members of Wellness Forum readily understand, even if this medical doctor does not, right? They should at least see it. Then they claim that drugs don't benefit most of the people who take them, at least for primary prevention in this case, but it's the only answer. So we have to prescribe them anyway. And remember, 249 out of 250 people don't benefit, and this cardiologist thinks that's just fine. So the bottom line is this. First of all, if the informed consent laws in every state were followed, as they're supposed to be because they're laws, most people would have to be given this data because before prescribing a drug to them. Okay, I can tell you how to do this with diet, no bad side effects, only good side effects. Or I can put you on a drug, not very effective, sometimes side effects. Some people think it's nocebo effect, but they say that they have them nonetheless. Which would you like to do? I'm sure there are many people who would just take the drug, but there are a whole lot more people who would at least try the diet. And a lot of times what I hear from people when they become new members of Wellness Forum is, if I'd known then what I know now, I would have changed my diet then. Nobody told me the statins didn't work and I had a heart attack. Nobody told me about Dr. Esselstyn or Dr. Barnard or Dr. McDougall or the other people who published data on this particular topic. Nobody told me. So that gives me the idea that if people were told, they would do something about it, right? So this is why you want to be informed. Just going backwards for a minute, I'll tell you, one of these days I'm going to file some lawsuits about this informed consent issue because I think it's so important. And I don't like filing lawsuits, but they do kind of make people pay attention, and some litigation and damage awards might make it the law of the land. They may follow the law of the land and start informing patients properly. So that's on my list of things to do before I leave the planet. But anyway, this is the reason why people join Wellness Forum, is because all the stuff that you wish you'd known then and now you know. Wouldn't it be nice if that was always the case going forward, that you learned how to check things out on your own, that you learned in the case of emergency? That's what we learned in this nocebo book. Boy, when it's not an emergency, check things out, because it's just astounding how much bad information is out there. So anyway, just a couple reminders. Food Over Medicine retreat coming up. Joining Wellness Forum, time's never been better to do it, because we're going to give you a gift card equal to the amount of dues you pay. So this is the time to do it. This will not go on forever, by the way. I'm not going to do it forever, but I'll extend it a little bit more because some of you have asked me to do it. Virtual yoga starts on April 9th. Food Over Medicine clubs, we're getting ready to start another round of them. So email me if you're interested in information on that. And with that, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it. And I will be back to you on Thursday with more news. Thanks for watching.